Hi, my name is Morgan Boyd. I'm an allied health major. I'm taking this class as just one of my requirements. And a little bit about me: I've been in radiology for 5 years as an X-ray tech, CT tech. I'm pursuing my bachelor's degree to hopefully become a director one day in radiology. So that's my main goal. Anyways, being in the field of radiology as a CT tech, I've seen patients come in frequently with symptoms of stroke, and CT is always the first to see these patients as we have to run a code stroke, which includes a CT of the brain and another CT of the brain with an iodine contrast that we use that highlights those veins and arteries for the radiologist in order to see any occlusions, bleeding, strokes. I've heard about the stroke belt before, but when thinking of topics for this paper, I knew in my field I would be interested in learning more about this particular region called the stroke belt and what the main risk factors could be to cause a significant increase in stroke and cardiovascular disease. So, my topic: the southeastern region of the United States, known as the stroke belt, has been recognized for some time now as it has a higher rate of stroke and cardiovascular disease compared to other areas of the country. The stroke belt includes 11 states: North Carolina, South Carolina, Georgia, Alabama, Mississippi, Tennessee, Arkansas, Louisiana, Kentucky, Virginia, and Indiana. The increased prevalence of strokes and cardiovascular disease in this region is a pressing public health concern, and several contributing factors includes socioeconomic disparities, lifestyle behaviors, and healthcare access. In these states, the stroke mortality rate is 30 to 40% higher than the national average. This region has been long recognized by health professionals for the alarming rates of stroke-related illness and death, giving the region the name the Stroke Belt. Stroke presents a significant and growing global health challenge. It is the leading cause of acquired physical disabilities in adults worldwide and ranks as the second leading cause of death in middle to high-income countries. The epidemiology of this region is characterized by geographic distribution, demographics, stroke incidences, and mortality rates, risk factors, and the underlying social determinants of health. Several factors contribute to the elevated cardiovascular disease risk in this area, including a higher prevalence of hypertension, diabetes, smoking, obesity, and sedentary lifestyles. Socioeconomic conditions such as high poverty rates, lower educational attainment, and limited access to healthcare further compound the problem, creating a cycle that perpetuates poor health outcomes. Individuals in these states often have less access to preventative care and health education, which can contribute to delayed diagnosis and inadequate management of chronic conditions like hypertension and diabetes. Communities with limited financial resources are often unable to access quality health care, nutritious foods, and safe environments for physical activities. This combination of financial barriers and limited health resources creates an environment conducive to the development of chronic health conditions. Lifestyle choices such as poor diet, smoking, and sedentary behavior are prevalent in the stroke belt and contribute significantly to the region's high rates of stroke and cardiovascular disease. Over the past 2 decades, cardiovascular mortality has significantly decreased among individuals living in both the stroke belt and non-belt regions of the U.S. Despite previous efforts to address geographic disparities, the gap in cardiovascular mortality between these regions remain. However, the mortality rate difference has narrowed by approximately 7 deaths per 100,000 people. So, going on for solutions for the stroke belt region: despite national advancements in stroke prevention and care, stroke remains a leading cause of death in this region still. One of the solutions is hypertension management programs. Hypertension is the leading risk factor for stroke. It is particularly prevalent to stroke belt, and effective management of hypertension has been a focal point in reducing stroke risk in this region. The Million Hearts Initiative is a nationwide program aimed at preventing heart attacks and stroke. The program's expansion in the stroke belt between 2017 and 2024 included widespread screenings, educational campaigns, and medication management. Another big solution could be telemedicine and telestroke. Telemedicine has been a transformative tool in reducing stroke mortality in the stroke belt. Specifically, telestroke programs allow neurologists to provide remote consultations to healthcare providers in rural and unserved areas. Hospitals utilizing the telestroke systems saw improved treatments times for ischemic stroke patients with more frequent and timely administration of proper medications, the most effective acute stroke treatment. This is in areas where local stroke specialists are unavailable. Telemedicine provides rapid access to critical expertise, reducing the time to diagnose and intervention, both of which are very crucial to improving patient outcomes. My final takeaway message from my paper is, the increased prevalence of stroke and cardiovascular disease in the southeastern United States is a critical public health concern that demands attention. This area, known as the stroke belt, has significantly higher rates of stroke and heart disease compared to the rest of the country, leading to the elevated mortality, long-term disability, and strain on healthcare resources. These health disparities reflect deeper issues related to socioeconomic inequities, racial health gaps, and limited access to preventative care. Additionally, addressing the broader social determinants of health, such as poverty and education, is crucial to achieving long-term reductions in stroke and cardiovascular disease prevalence. By understanding the scope of this problem, individuals, healthcare professionals, and policymakers can advocate for more effective public health strategies, improving both regional and national health outcomes. I've learned a lot during this process of writing this paper, not only so much on the topic of stroke belt, but also how to properly write, gather information on different topics in my subject, how to bring it all together to create a complete research paper. I've learned a lot in this class and have enjoyed this semester.